Well, today we're in lab for the Medical Laboratory Science program. This is the Clinical Microbiology course, and the students are working on identifying organisms that cause common infections. So this class in Clinical Microbiology, we are training technologists to work in hospital labs, primarily to identify infections in patients. So post-surgical infections, people who come in with an infection. If you've ever had strep throat, that's another one of the things that we diagnose for the physician. He sends a throat culture to us and we tell him whether or not there's group A strep in it or not. The first thing students are going to do is assess the culture. So they look at their plates, see how many bacteria, different types they have on the plate. And then we use a number of tools to pick those bacteria and then inoculate them into the test. And that's what you are seeing today. They would pick from a colony, take hundreds of thousands of organisms and put them into each one of the tubes that they were working on. The program starts in January. That we have a bit of an unusual intake. Starts in January and goes to the following June. So it's almost 2 years here at BCIT, and then they spend a full year out at the clinical sites. That means that they go to hospitals or private laboratories across the province and spend about 44 weeks doing their training on how to do the job before they write their exams. They're going to be medical laboratory technologists. So it's a small field. There's only about 12,000 technologists across the country, and it's primarily for medical laboratory diagnostic work. We always wear some kind of personal protection. So the students you saw today are all wearing gowns, lab gowns. The lab gowns have a waterproof panel on the front, so if they spill anything, it protects them and their clothing. And then the second level is that we have to protect the specimen. So that involves a concept called Aseptic Technique, where we make sure that we don't introduce anything else into the culture. So the sterilizing of the tools, you saw them flaming. We use nothing but sterile equipment. All the liquids that we use are all sterilized. So it's a two-step process. We protect ourselves and we protect the culture. That's why we tell you to wash your hands before you leave the lab. A good microbiologist keeps their hands clean when they come to work, and they clean before they do anything else once they leave the lab. So hand washing is the biggest thing for keeping germs at bay.